Hi, Mr. Jones?
Yes.
Hi, I'm your nurse for today. I'm Jennifer. I'm from the health department.
Nice to meet you.
So I hear you're here on a follow-up appointment. Can you tell me about what brought you in? Like, why are you here today?
Yeah, well, I'm 55 and I'm half Latino, and my dad had a history of a heart attack, and I had some chest pain a while ago. And I've been diagnosed with high blood pressure. They put me on this thing called Norvasc, 5 milligrams daily. I take it occasionally, sometimes, when I remember. But I work for a crane operating agency, and they don't provide health insurance, so my finances are kind of limited and kind of stressed out about that. But I've had some swelling in my lower extremities since taking this Norvasc.
Okay. Well, all right. Well, let's start off. My tech, I saw, already got your height and your weight and your waist circumference, other things that we typically do. Do you mind if I go ahead and check your vital signs real quick?
Sure.
And then we will discuss a little bit more. And just relax your arm here. And check your blood pressure first. Okay, 148 over 90.
Is that good?
It's a little high, I'm not going to lie to you. But we'll discuss that in just a moment. Let me take your temperature. You want to open your mouth and do the tongue, please? Okay, 98 is your temperature. Beautiful. That's good. Ooh, forgot to wash my hands here. Alright, I'm going to check your pulse right here in your heart, okay? Okay, I'm getting 88 beats per minute. And respirations are 18, okay? Okay, so now that we have your vital signs, as I explained to you a second ago, 148 over 90. Let me write these down. That's a little high. I see here in your paperwork that you went to the hospital, right? And they told you your blood pressure was a little high. They gave you the Norvasc. All right. So have you taken your medication this morning?
No, I didn't.
Okay. How often have you been taking that in the past 2 weeks that you've had it?
Here and there when I can remember. But like I said, I don't have insurance, so...
Okay. Do you have a blood pressure cuff at home?
No.
Okay. It's very important that you would check your blood pressure each time before you take the medication. And your blood pressure is high. 148 over 90 to me is saying that you do have hypertension, which is high blood pressure. I'm not sure if you're aware, but it can lead to other things. Have you heard that high blood pressure can lead to other things at all?
No, not really. I mean, I feel fine. I don't have any complaints.
Okay. All right. Can you tell me about a little bit your family history? Like, what about your parents? Did they have any kind of heart issues, any troubles?
Well, my dad had a heart attack.
Okay.
And I grew up with my grandparents in Tampa, but that's all I really know. My dad.
Okay. Did your dad ever have any kind of chest pains? Did you hear if he had high blood pressure?
Chest pain.
Okay. All right. I noticed you have a little bit of a Spanish accent. Are you Hispanic? Like, can you tell me your background?
I'm half Latino and half Caucasian. I speak Spanish fluently, but I was raised with my grandparents in Tampa, and they spoke English at home.
Okay. What about your diet? Tell me a little bit about what you eat on a day-to-day basis.
I really eat what's convenient, fast food.
Okay. All right. So a little bit of sodium in that food then. All right. What about your weight? Have you heard that you may be a little overweight?
Well, I know I could use to lose a few pounds, but...
Okay. All right, yeah. Because my tech took your weight, and you were 229 pounds, and your height's about 5'9". We use a thing called the body mass index here, and body mass index calculates, if you're underweight, overweight, things like that, and it's showing you're a little overweight. That can have an effect on blood pressure, just so you know. The swelling you've been seeing in your feet could be a side effect of the Norvasc. You said you haven't been taking it regularly, but that is a side effect, okay? I know they taught you at the hospital, but each time you take Norvasc, you need to check your blood pressure, because what can happen is that if your blood pressure is low, say you're sick or you're dehydrated one day, you don't have enough fluid in you, because you say you're a crane operator and you work outside, so that could be a thing that happens a lot. Your blood pressure is low. Say the top number is below 120, that's what I consider as low, and you go ahead and take your medication. It's going to drop you down lower. You could have some dizziness, some lightness, lightheadedness, and then you're going to pass out. And then when you fall, you have a whole other world of problems going on there. So very, very dangerous if you're not checking your blood pressure regularly. So I would encourage you to go out and buy a blood pressure cuff. You can get them at CVS, Walgreens, wherever, and they're not that expensive. And I know that you said you have some trouble with money, but it would really, it'd really be a good investment to go ahead and get one, because, like I said, hypertension is what I'm seeing here.
Right.
I'm not going to diagnose you because I am not the physician. That would be the doctor's job when he comes in to see you. However, I am seeing high blood pressure. High blood pressure, as I explained to you before, can have some effects, and you said you didn't know anything about it, but can lead to things like heart, stress on the heart, which you said your dad had a heart attack, so you already have some family history of heart problems, but can lead to congestive heart failure, can lead to kidney problems later on in life, because it's those, your blood vessels. What's happening here is that your blood vessels are closing up because of the stress in your body, and it's going to lead, put stress on the kidneys. So blood pressure really is something, because you have blood vessels all over your body, and blood pressure really is something that affects the whole entire body. Right. Okay. And if you're ever stressed, do you ever get stressed from time to times? Okay, stressed about money, you said, things like that. That's going to lead you to have a higher blood pressure. So not only do you have a high tendency for high blood pressure, when you're stressed, when you're worried, can lead to higher blood pressure. Okay. So you grew up in Tampa, and you said you're a crane operator. Did you go to college for that at all? Do you have any kind of background education?
Well, I went to 2 years at a community college.
Okay.
So.
Okay. And you said you're a crane operator. You said you do or do not have health insurance?
I don't.
Okay. All right. So what we can do is we can get you a referral with the health department to speak to someone who can help supplement for those kind of things. So we need you to probably stop by our case management office on the way out, and they can set up some kind of an agreement, helping you get like a blood pressure cuff, things like that. I know. Okay. So, all right. Well. Looks like we've gone over everything we need to go over here. Your pulse rate looks good, temperature is good, and do you have any questions for me?
No, you've answered all of my questions pretty well, and I now understand what high blood pressure can do for me.
Okay. All right. So you're going to need to be more regimented about checking your blood pressure, as we said, and taking your medications, okay? And you're going to need to call us back and set up a follow-up appointment after the doctor comes in, and really be regimented about that medication, okay? It's something that's what keeps you on, all right? So thank you so much.